everyone, today we are talking about different types of acne treatments. If there is a big takeaway from today's video, it is that all acne is not created equally. My acne probably doesn't look like your acne, who doesn't look like your friend's acne. So to just assume that all types of acne would respond to the exact same treatments is completely unrealistic. So today we're going to talk about different types of acne complaints that we hear and different types of products that will help your acne the best. All right, we're going to get started with the dreaded blackhead. We all have them, we all hate them, and so when I typically hear of somebody complain about blackheads, I think of two different products. The first of which is salicylic acid. So that's going to be more of a chemical exfoliator for the skin, helps to really get into your pores, unclog them. There's a really awesome product over the counter that I like by Cerave. It's their SA Cleanser. So you can start to incorporate that one, if not 2 times a day. Obviously start with one and build up as you need to. If you're using that consistently and still haven't really noticed the results that you were hoping, then I would consider adding in a retinoid. Retinoids, you have 2 really awesome options over the counter. The first is which is Differin Gel. Second, by the company RochePosay, it's their Effaclar Adapalene. So awesome products. They will be linked at the bottom as always. You can start incorporating one of those, maybe 1 to 2 nights every other night as you can tolerate it. But those are typically going to be your best blackhead fighters. All right, now switching gears to the whitehead. So you're thinking more of those like pus-filled pimples. Typically they have more of a bacterial component to them, so that's going to respond better to benzoyl peroxide. If you are struggling with them mostly on your face, there is a really awesome benzoyl peroxide product from Cerave again. It's their Acne Cream Foaming Cleanser. That is a 4% benzoyl peroxide versus if these are mostly on your chest, in your back and shoulders, I usually like the Panoxyl. That is 10%. So that may be a tad bit strong for the face. Chest and back can tolerate it really well. So that's going to help to get rid of those pus-filled whiteheads. Okay, cruising right along. So what if you don't necessarily struggle with blackheads or whiteheads, but you're getting a lot of those like painful, deep breakouts? Now, that typically is going to be an indicator that you should schedule a visit with a dermatology provider to get on some acne prescription medications. But in the meantime, something that I really like is just a natural anti-inflammatory for the body to calm down a lot of that inflammation that's causing a lot of those deep, painful, almost cystic type breakouts is zinc. The recommendation for zinc when it comes to those types of breakouts, not to exceed over 75 milligrams. So normally 30 milligrams is what you'll get in the capsules over the counter. So you can start with 1, if not 2 of those a day, but I wouldn't wait too long to schedule up a visit with a dermatology provider. What happens if you don't really have anything that we've talked about so far, but you might have just kind of like that persistent redness? Typically, my mind goes straight towards my anti-inflammatories if that's the case. So a really awesome one that typically we can write it as a prescription, but there's a nice over-the-counter option to begin. Azelaic acid is the name of it. So The Ordinary has an azelaic acid suspension. It is 10%, which is a good introductory anti-inflammatory for the skin that's going to really help with the redness. The other product, switching gears, is niacinamide, which is gaining a lot of popularity in skincare right now. RochePosay, their Double Repair Moisturizer, has some niacinamide in it. So that's a really nice moisturizer that you can use twice a day that can help to calm down a lot of that underlying redness. All right, fast forward, let's say 4 months from now. Your acne is so well controlled. Everything that we've talked about has done its job, but you have some residual pink, purple acne scars left over. So 2 things are really going to be effective for acne scars. In the morning, sunscreen. People don't necessarily think about it, but getting sun exposure on unprotected skin is going to darken your scars. And so making sure you're using a daily sunscreen 365 days out of the year that has zinc or titanium dioxide in it, so more of your mineral sunscreens, that's going to help the acne scars from darkening. It's not glamorous, I know, but it's going to help a lot. And then also retinoids. So we talked about those for acne treatment. I really like them for acne scarring as well. So either of the two options that we talked about, Differin, RochePosay, Effaclar, Adapalene, are great. Neutrogena actually has one that has been specifically formulated, and they're advertising it for acne scars. So it's called their Stubborn Marks, I believe it is. So that's a really nice one as well. Any retinoid at night is going to be complementary to that sunscreen in the morning. Scars are slow. Scars will take every bit of 3 to 4 months to really lighten up, but those are going to be the two most effective things to do so. And then for that person out there that says, I have tried everything that she recommended and nothing is helping, it's probably time to schedule up a visit with a dermatology provider. The ingredients are probably right. The strength is probably lacking. So there's a lot of other stronger prescription strength alternatives to what we talked about. Never hesitate, never wait too long to get your acne treated, but these are really good things to start with. Give your skin maybe a couple of months of trying these things, but don't hesitate to schedule up an appointment.